Hey, good morning, everyone. Happy Saturday. I just wanted to come on today to talk a little bit more about heart disease and the coronary calcium heart score test. I got mine this morning. And so, as we've talked about before, cardiovascular disease is the #1 killer of men and women in the United States. And so that's the big reason I got it. And I have, I'm of a certain age, and I decided I would go get this test. So what is it? It's a non-invasive test. It's a CT scan of the heart. It took 2 minutes, and there's no IVs, no contrast dyes, none of that. You just go in, and they have the ability to look at the 4 coronary arteries and show what your if you have any calcium buildup. And so it's and the more calcium buildup that it shows, the higher risk of cardiac events and future cardiovascular events. And so who does not need this test? Anybody that's had a coronary artery bypass graft, anybody with stents, or anybody that's had cardiac catheterization. They just don't need it because they already know what's going on in there. But who does need this test? Almost anybody over 40 could get it. Or and maybe even younger if there's a personal or family history of coronary artery disease. High cholesterol, anybody with high cholesterol, it's a good idea to get the test. Anybody overweight or inactive, those sorts of things. So, and it's important to remember this is not an absolute test. Sometimes there's soft plaque buildup that it doesn't identify, but it's not an absolute predictor, but it is really a nice newer test. It's really only been out for and more popular over the last 5 years or so. Typically not covered by insurance yet, although I think that'll be changing. Your doctor can write an order for it though, and so or your nurse practitioner, and they may be able to cover it. So consider that, asking your primary care provider about that. But it cost me $75. Usually it's anywhere from $50 to $100, and you get the test results right away. I got a little consult with the nurse, and it was great. And I got my cholesterol checked at the same time. So I'm going to show you my results in a minute, but just to understand the scoring, the best score is a 0, meaning there's no plaque buildup. And then the 0 to 10 shows, I'm going to look at my little cheat sheet because they gave me a cheat sheet. I'll show it to you in a second. 0 to 10, minimal identifiable plaque, and that's very unlikely risk of heart artery disease, but it's less than 10%. 11 to 100 is there's definitely some disease, but it's mild risk, maybe some mild narrowing of the arteries. 101 to 400 is definite risk, and they probably need to be talking to their primary care provider. Moderate risk and mild coronary artery disease is likely. Anything over 400 is definite. There's at least moderate plaque, and it can even go as high as more than 1,000. And 10% of scans actually are more than 1,000, which means they're high risk, moderate to severe coronary artery disease. And so it's such an easy test. I really encourage you guys to go get it. I will show you what my scores were now. I'm going to flip this here. Okay. So as you can see, it shows the 4 different coronary arteries, and mine were 0. So I was very happy about that. And this shows the different calcium scores. So, and they also checked my cholesterol, which was also very good, and my triglycerides and everything. So all of that said, I eat a whole food plant-based diet, and this is more than anything validation of that, as well as the fact that I exercise, manage my stress, all of the things that, I think lifestyle makes a big difference. I haven't always eaten this way, which is another reason I did this test. And so, and I haven't always been healthy. It's really only been like the last 7 years. And so, that's just the big reason I did it. And again, validation that it's good right now, so that's good, and I don't need to get it again for 5 years. And so I just encourage you to talk to your primary care provider about it and check it out. All right, let me know if you have any questions at all.